Patient summary. All demonstrations are using a test database and test patients. No live patient or provider data will be shared. What is patient summary? In collaboration with Canada Health Infoway and the Government of Alberta, HealthQuest has integrated patient summary submissions right from your EMR. The Canadian Patient Summary is a standardized collection of patient information used to enhance patient care by having multiple clinicians across disciplines able to contribute to a shared patient record. Information from the patient's clinic health record is sent right into Alberta Netcare, enhancing patient safety, supporting transitions of care, and helping to create better health outcomes. To be able to utilize Patient Summary, the provider must be signed up for CII-CPAR as it uses the same transmission pathways. Enabling Patient Summary. To enable Patient Summary, a clinic administrator will need to go into Setup, Program Setup, Admin, CII, and ensure that PSAB has been checked off. Click Apply and OK to save the changes. Next, the clinic admin will need to go into the provider's client card. Open the Practitioner tab and check off Patient Summary under the CII export settings. Again, the provider must be signed up for CII-CPAR to be able to submit patient summaries. Once enabled, you will see a Patient Summary button in your charting window. Click on this and the curation window will open. As you can see here, you're able to upload medications, allergies, problems, procedures, vitals, social history, and family history. Next, we'll walk through the different sections in the Patient Summary window and where the data flows from in the EMR. What data is uploaded and where does it come from? Medications. For the Medications section, you have the opportunity to upload all medications prescribed in the clinic. For the patient, it will upload the medication name, the dosage, last prescribed date, and the status, being active or inactive. It may not be necessary to share all medications prescribed in the office, but this information could be especially meaningful if a patient experiences side effects or if a medication does not have the desired effect. Providers can provide context or further information that may assist another provider who's caring for a patient. The allergy section in Patient Summary pulls from the allergy section of the patient chart. You're able to upload any allergies listed in this box. The information uploaded includes the type of allergy, the severity, and when the allergy started. Again, there's a notes box present in this section of the curation window. Problems will pull from the Problem tab. The information that can be uploaded via Patient Summary is the problem type or name, the status, being active, resolved, or permanent, the severity, and the start date. If you record items using a diagnostic code, this is listed as well. If you end date a problem, it will not be available in the curation window for you to submit. Vitals. Vitals can be recorded in any charting template. The vitals that can be uploaded are height or length in children under 2, weight, BMI, and head circumference. History templates. HealthQuest has developed 3 medical history templates to assist in uploads. They are listed in the available templates when you click to create a new visit. These templates were automatically loaded into all clinics. Please contact tech support if your EMR does not contain these templates. Your existing medical history templates may be able to be mapped by our support team to work with the uploads. Please call us if that's something you'd like us to look into. The first template I'll showcase is the procedure history. As you can see, there's a notes box in this upper section. The notes box can be used for additional information that doesn't fit into the fields shown below. Anything written in this box will also transfer to the notes box in the procedure section of the Patient Summary curation window. This template can be used to record procedures completed within the clinic, like mole or cyst removals, IUD insertions, and other minor procedures. It would also be beneficial when seeing patients who may be new to the province, as any procedures or surgeries completed outside of the province are not available on Netcare. You can record the date of the procedure, the status, being completed, pending, or cancelled, the name of the procedure, a follow-up date if necessary, and any results or other information. Click on the Add button to add additional items. All of the fields in this template are mapped to upload to the patient summary. The next template we'll review is the social history. This template contains fields to record lifestyle information that are important about the patient's health, like tobacco, alcohol, and a social alert field where you can record things like exercise, illicit drug use, or a living or marital situation. The last template that we're going to review is the family history template. As you can see, this template contains the notes box that also moves the information across to the curation window. In the family history template, you're able to record what the person's relation is to the patient, the diagnosis that you are recording, any notes about that, the onset age of the diagnosis, and the death age and cause of death if applicable. Click the Add button to add additional items and additional family members. Creating and submitting patient summary. Submissions are done manually. By default, the window will select all. You can then deselect that if you would like to pick specific information to upload. The sections made in the curation window are patient-specific. A provider could have another staff member, like a nurse or MOA, make the selections in the curation window, and they'll save as a draft so that the provider can review and submit. Submissions do not need to happen at every visit. You can do an initial upload of important information and then do updates as needed, maybe at an annual physical. Each provider who submits a patient summary will have their own document listed in the patient summary section of Netcare. As you provide updates to the information, the updates apply to the same document. You do not create multiple documents as you provide updates to the patient summary. Reports and confidentiality. If the patient wishes to not have any information disclosed, you can use the security log button in the curation window or the chart security button in the charting window to mark the patient as externally confidential. This will stop any of the information flowing to Netcare. If the patient would prefer to only have specific items not shared, you're able to deselect the item and select an empty reason and send that with your summary. You can use the View Report button up at the top to view a list of patients who have had summaries submitted by the clinic, either by a specific practitioner or all of the practitioners listed, under a certain date range. Use your View History button to review the summary of the information sent for the patient. For more information on patient summary, please click the links in the description to be taken to the knowledge base articles regarding patient summary.